Hi, everyone. Welcome to our 2026 Global DARE update. My name is Kristie DeMarco, President of Global DARE Foundation, and I am joined today by my friend, fellow patient advocate, and Global DARE's Vice President, Susan Kuranoff. We are delighted that you are here spending time with us today. We are grateful that you are part of our community. Today, we're excited to share some of the incredible progress that we've made over the past year and the opportunities that lie ahead. Before we begin, I'd like to briefly remind everyone why Global DARE exists. Our mission is simple, but it's powerful: to build and improve the lives of people affected with adult refsum disease through research, education, awareness, and community support. Our vision is very ambitious. By 2030, we aim to help launch at least one clinical trial for adult refsum disease and cut the time to diagnosis in half, going from 15 to 20 years to hopefully 7 to 8 years, so that future generations spend less time searching for answers and more time receiving the care they need. When Susan and I founded Global DARE in 2019, we were a very small, volunteer-led organization driven by hope and determination. We believe that patients and families could play an active role in advancing research and improving care. Today, that vision is becoming a reality. We now have an international network of patients, clinicians, researchers working together. We have funded research, expanded awareness efforts, established educational programs, and built research partnerships and reached milestones that we once felt were out of reach. Most importantly, we have a lot of momentum, and that's really what today's webinar is all about. It's about celebrating progress, sharing what's happening across our community, and showing how every one of us has a role to play in building a better, brighter future for people living with adult refsum disease. Thank you for being part of this journey. Now let's get started. I'd like to share a very historic milestone. One of the most exciting things that we've been able to do is publish the first ever clinical guidelines for adult refsum disease. For many rare diseases, clinical guidelines don't even exist. As a result, patients often receive different recommendations depending upon where they live or what healthcare providers they're seeing. These guidelines help change that. They provide clinicians around the world with evidence-based recommendations for diagnosis, monitoring, and management of adult refsum disease. What makes this especially meaningful is that this has been a 6-year journey. Since Global DARE was founded, we have worked closely with clinicians, researchers, dietitians, patients to bring these guidelines to life. As patients ourselves, Susan and I were honored to contribute as authors and help ensure that the patient perspective was included throughout the process. We also funded open access publication of the paper, meaning anyone in the world can access it free of charge. This publication is more than a paper. It's a major step forward in improving care today while we're laying the groundwork for future therapies and clinical trials. We're also excited to share that a patient-friendly layman's version is currently being developed and should be released later this year. Now I'd like to talk a little bit about our team. When Global DARE was founded in 2019, as I mentioned, we were entirely volunteer-led. Today, we have grown into a professionally supported organization with a dedicated board of directors and leadership team focused on advancing research, expanding awareness, and strengthening fundraising and supporting our community. Over the past 2 years, we've added key leadership roles, including our scientific director, development director, and communications director. We also expanded our board with individuals who have expertise in research, governance, fundraising, business, and advocacy. This growth matters because solving a rare disease takes more than just passion. It requires infrastructure, expertise, partnerships, and long-term commitment. The team you see here represents the foundation we are building to help advance our vision of launching a clinical trial by 2030 and reducing the diagnostic journey for future patients. Now I'm going to hand it over to Susan to talk about our important food testing program. Over to you, Susan.
Thanks very much, Kristie. So improving dietary guidance remains one of the most practical ways we can improve the quality of life for people living with Refsum disease. And we know that's really what our mission is all about. This is why one of Global Dare's longest running and most impactful initiatives is our food testing program. In 2025, we were able to test up to 35 additional foods thanks to a $20,000 grant secured by Refsum Germany, which we are extremely grateful for. Every food that we test helps fill critical gaps in knowledge and gives individuals more confidence in making everyday food decisions. And this year, we're working on updating the dietary guidelines, which we expect to release later this summer. These recommendations will reflect the latest testing data and the current scientific understanding. Another important milestone is the food testing manuscript currently in development. This publication will document both our methodology and results, helping to ensure that the information is available not only to clinicians and researchers, but also the Refsum community worldwide. We're also creating a comprehensive food database that will include all foods tested to date, along with their level 1 and level 2 classifications. This resource will make it easier for all to access consistent dietary information at a glance. And looking ahead, food testing, of course, remains an ongoing need. Through our Summer Spotlight campaign, community members have the opportunity to raise funds themselves and nominate a food item for future testing. Ultimately, better food data leads to stronger research, clearer dietary guidance, and a better quality of life for everyone affected by Refsum disease. On to the next slide. So earlier diagnosis begins with awareness about Refsum disease, and awareness begins with educating the professionals who are most likely to encounter Refsum. One of our strategic priorities is reducing the time it takes for someone with Refsum disease to receive an accurate diagnosis by half, as you just heard Kristie mention. Because Refsum disease is rare, many ophthalmologists, neurologists, geneticists, and other healthcare professionals have unfortunately never encountered a patient with this condition. So this year we have two major opportunities to increase awareness on a global scale. The first is United in Vision 2026 taking place in Dallas, where Global Dare will be represented by Kristie DeMarco and Dr. Diane Mitchell. This event brings together leaders from across the inherited retinal disease community and provides an important platform to introduce more clinicians and researchers to Refsum disease. Our second major outreach this year is the Euretina 2026 in Vienna, one of the world's largest retina conferences, attracting approximately 9,000 ophthalmologists and retinal specialists. Global Dare will be represented by Kristie DeMarco, myself, Susan Kuranoff, and Chantal and Stefan Valkenberg, a couple who are impacted by Refsum. Last year's Euretina meeting demonstrated just how valuable these events can be. If you remember, we connected with clinicians from dozens of countries and found that many had little or no awareness of Refsum disease. So this year we hope to build on that momentum and continue expanding awareness, strengthening professional relationships, and encouraging earlier recognition of symptoms. We know that every clinician who learns about Refsum disease represents a potential earlier diagnosis for someone who's still searching for the answers. On the next slide, I'd like to talk about the Patient Collaborator program. So preparing patients to become informed research partners is essential if we want to accelerate progress towards future therapies and get to our first clinical trial. Over the past year, Global Dare has invested heavily in recruiting patient collaborators and developing our collaborator training program. So this program was created to empower members of our community with the knowledge and skills needed to actively participate in research discussions, regulatory activities, and future clinical trial planning. The first 7 training modules focus on foundational topics, such as the role of patient collaborators, clinical trials, registries, natural history studies, and regulatory pathways. So these modules will help collaborators understand not only how research works, but also how their lived experience can influence and improve research. We then expanded the program with a second set of modules focused specifically on adult refsum disease. These disease-specific modules cover topics such as the biology of refsum disease, genetic testing, current and emerging therapies, translational research, research funding, biomarkers, and outcome measures. So all modules through to module 10 are already available, and we expect the remaining modules to be released imminently. All of the modules currently deployed are freely available on our YouTube channel, and we do welcome you to access them and watch them at your leisure, even if you're not a collaborator. Our goal is to build a knowledgeable and engaged community that can partner effectively with clinicians, researchers, regulators, and industry as we move towards our goal for a clinical trial by 2030. An informed patient community is one of the most powerful assets we can create for the future of refsum research, benefiting all of us. And with that, I'll hand back to Kristie.
Thank you, Susan. That was great information. Always excited about these particular programs that really bring great information to our community. So let me move on to the next slide, which I want to talk about our Refsum Without Borders initiative. Similar to 2025, my husband John and I will be traveling overseas this fall. We're visiting Spain, France, Belgium, the Netherlands, Germany, Australia, and the Czech Republic. Our goal is to meet with patients and families where they live, connect with clinicians and researchers, strengthen partnerships, and continue raising awareness for adult refsum disease. As we saw in our travel in 2025, every new connection creates an opportunity and strengthens our community. It may also lead to an earlier diagnosis, a new research collaboration, a future patient referral, or simply help someone realize they aren't alone. If you live in one of these countries or you know someone we can connect with, we would love to hear from you. I'd love to be able to connect with more people from our community in person. Together, we are building a truly global community. Next up, I'd like to talk about our Refsum Research Summit. This is perhaps the most exciting event we have on the calendar for this year, and is taking place on June 27th in Chicago, both an in-person and virtual participation. This summit will bring together patients, clinicians, researchers, and the Global DARE Foundation team to focus on our shared goal, building a research roadmap towards a clinical trial in 2030 and reducing the time to diagnosis. If you're interested in the future of refsum disease research, I highly encourage you to register for this event and participate along. As part of the Refsum Research Summit, there was a lot of work that had to go into preparation. And over the past several months, 6 expert work groups have been meeting to identify gaps in understanding and chart the way forward for refsum research. These groups are focused on vision and retinopathy, nutrition and exercise, neurology, emerging therapies, apheresis, and research assets. Together, these work groups are helping to answer 3 important questions. What do we know? What don't we know? And where should we focus next? The roadmap that emerges from this work will help guide future investments, collaborations, grant opportunity, and scientific priorities. And we plan on publishing this roadmap so it's available for everyone to see. And most importantly, it ensures that the research that we are driving will meet the needs of people living with refsum disease. This is a critical step forward as we build a pathway towards earlier diagnosis and future therapies. Everything we've talked about today, from clinical guidelines to food testing, education programs, outreach initiatives, and research planning, requires funding. The good news is that we have tremendous momentum. We have made significant progress over the last years. We have a stronger partnership, more researchers engaged than ever before, and a growing international community. but there is also a sense of urgency. The opportunity in front of us is real, and we need sustainable funding to continue moving forward. Our fundraising priorities are focused on 3 areas. First, securing multi-year support for our research roadmap. If we want to advance the research on this roadmap, we have to be able to have a sustainable source of funding. Second, we need your help in peer-to-peer fundraising and recurring giving programs that create reliable, ongoing support. And third, we need to build stable funding for research, education, and community programs. The reality is that rare disease progress doesn't happen overnight, but every donation, every fundraiser, every advocate, every supporter helps us move us closer to better therapies, earlier diagnosis, and together we're turning momentum into lasting impact. And in closing, as you can see, 2026 is shaping up to be an important year for the Refsum community. We're building a tremendous momentum, and most importantly, we're doing it together. If you haven't already registered, please consider registering for the Summer Spotlight on Refsum Awareness. It's a great opportunity to help raise awareness, engage others in our mission, and support the work we discussed today that is helping move us closer to earlier diagnosis and future treatments. Links to the Summer Spotlight, the clinical guidelines publications I mentioned earlier, and the Refsum Research Summit can all be found in the YouTube description below. Thank you for taking the time to stay informed and engaged. We hope you continue to be part of this journey as we continue towards earlier diagnosis, better treatments, and a clinical trial in 2030. Until next time, take care, stay connected, and continue to dare to believe in what's possible. Thank you.